Federal health officials are asking Canadians to remain vigilant until vaccine access fully expands. 4 different vaccines are now approved for use here in Canada. That doesn't mean, though, that you should try to pick and choose which one you want. What really matters is that they all protect you from getting seriously ill. Eric Sorensen explains.
The vast majority of Canadians plan to get a COVID-19 vaccine.
Yes, I'd take anything as soon as I can.
Really?
Yes.
But some vaccines have shown higher efficacy than others. It's got Olivia Esther wondering.
The thoughts cross my mind. I mean, which one am I going to get? Do I have a choice?
And Talbert Johnson.
Some have this efficacy number that's higher than others.
That's a good point. I haven't really thought about that.
I don't know if we have a choice for which ones we get.
4 vaccines have been approved in Canada. The efficacy against mild COVID has found to be over 90% for Pfizer and Moderna, and between 60 and 70% for Johnson & Johnson and AstraZeneca. But this is where the efficacy comparison can be misunderstood somewhat. The trials have been conducted by different companies in different ways, with different groups, and at different times. Johnson & Johnson, for example, held trials with more older people with underlying conditions. J&J and AstraZeneca both held trials later and in regions such as South Africa, where COVID variants emerged.
When these trials were run, there were a different number of variants available at the time. So you have this one vaccine trying to do it all. And the fact that on average they're still doing this well is really good news.
Many experts say here are the most important numbers. For all vaccines, protection from severe COVID is closer to 100%, and protection from hospitalizations also upwards of 100%, though the data are changing and nothing is foolproof. The evidence overwhelmingly suggests vaccines all but eliminate hospitalizations and deaths.
All of the vaccines will keep you out of the hospital. All of the vaccines will keep you out of the morgue. And those are the only 2 things we really care about.
So I encourage you to get your vaccination when your turn comes, with confidence in the vaccine you're receiving.
Some would prefer a specific vaccine like Johnson & Johnson.
It works against the variants, it seems, and it's a one-shot and you're done proposition.
But Tom Chown says he'll take what's offered.
But at this point, anything.
Most will, including Talbert.
The first one that's available.
And Olivia.
Yeah, I'm going to get vaccinated, you bet.
Growing recognition that vaccines bring the ultimate goal within sight.
I'd like to be vaccinated and carry on with life.
Life a little closer to normal. Eric Sorensen, Global News, Toronto.